Good afternoon from Functional Horsemanship. Today I want to talk about treating some eye injuries. Horses receive, very seldom do they receive eye injuries, but when they do, they can become problematic. They can get infected. It can be anywhere from just a disease, they get a cold or whatnot, or they could poke their eye on a piece of cactus or a piece of agave, and it'll require some treatment. What I like to do is get a wet piece of gauze with some normal saline, like you'd use to rinse your own eyes out with, or a product called Clear Eyes. And I like to wipe away all the gook out of their eyes and clean that eye up pretty good. From then I'm going to be using some antibiotics, an antibiotic ointment. And what you have to remember is you can't use antibiotic ointment that has the hydrocortisone in it. You have to use the natural triple antibiotic. It comes in several different formats here. It's normally a paste. They make smaller ones. They make ones that are ophthalmic antibiotics, and that's a better one to use. But if you don't have it, you can use the triple antibiotic ointments. Sometimes if you have a big tube like this, it's hard to get it in their eyes. So what I like to do is get a sterile syringe here, and I mate this up with the tube, and I could draw some antibiotic ointment up into the tube like this. From here I can use putting this directly into his eye. Okay, the preferable solution though would be to use the ones that are made for the eye that have more of a round end on them. It keeps you from having to poke the horse. When I get the horse set up here, I'm not going to try to tie him down, because if he moves off, I want to go with him, and I don't want him to reach a point where he has to pull back and break something. So from here, all I'm going to do is put this in the corner of his eye. I'm going to keep the end of this antibiotic tube away from the eyeball. I'm going to put it in the very corner of his eye here, and then the corner of his eye here, and let his normal eye movement back and forth move that around. So I put that in the very corner of his eye. There you go, Junior. You have to get it past the eyelid there, otherwise it's just going to be out on the outside of the eye, and you have to get it kind of in there. And once I do that, I'm going to do that on both sides of his eye. I'm going to make sure that I wipe away any of that excess that will attract sand as he lays down. And then I'm going to get a clean fly mask and put that on him as well. And I'm going to do that twice a day for about 5 days to clear up that little eye infection. Hope this helps you treat your